when someone has a mental health crisis, there's like a whole spectrum of like need, and it feels like individual therapy in this time-limited setting and the police, the emergency room, and inpatient treatment are on like opposite ends of this spectrum of need, and there's a lot that falls in between. And so I feel like crisis response really targets that in between. My name is Biz Sorenson, and I'm a mental health therapist at the College of St. Scholastica. Working in the counseling center at a college, we actually use the crisis response team pretty frequently. A lot of times when someone is having a mental health crisis, 1 hour with their therapist isn't actually enough. And so it's so nice. A lot of times I've used the crisis response team when I know that a student needs ongoing support, but that support is extending beyond like what my schedule allows. And so I've brought crisis response in to work with students that I've already been meeting with. I've also done a lot of safety planning where my therapy clients will have utilizing crisis response as part of their safety plan when they leave the therapy office. So in the evenings, on the weekends, at times that are, we're not available. When I think about students I've worked with in the past before crisis response existed, a lot of those students were, if you ask anyone that works in like Miller Dwan or the ER setting, they were bogged down in these systems where they had to wait hours, if not days, for a room. A lot of times like mental health crises would erupt into like being on the run or kind of bigger issues where then now the police are involved, now an ambulance has to get called, now we need our school resource officer has to be giving rides when they could be staying at the school and addressing issues that are happening here. Now students and families need rides to the ER. I mean, it's just like so many other resources are needed when mental health isn't addressed. And so crisis response, like, I just feel like funding that just frees up everyone else to do the jobs that they were trained to do and that they are like wanting to do. Historically, I worked with, and currently I work with a lot of students of color. I worked with families of color who were wildly uncomfortable and really didn't feel safe calling the police when they were, especially when they were in crisis. So that meant extending my time with students, having to cancel other appointments or really move things around, having to work outside of working hours, and just kind of being put in uncomfortable situations for both me and my students and school staff when crisis response wasn't available. I do think it's a wise choice for the city of Duluth to use money, to spend money on the crisis response team. First of all, I think we owe it to our community. As a mental health provider working in community-based settings like schools, I've worked in K-12 and college education my whole career. The number one thing you hear when you ask staff or faculty, like, what do students need? It's mental health support, mental health support. When you ask people in the community, like, you know, what are some of the issues in Duluth? You always hear about these like unmanaged mental health issues and substance use disorders and chronic homelessness. You know, a lot of these things go back to like early intervention and robust supports for mental health. Things like the crisis response team that get people the help they need without kind of whatever they have going on escalating into a bigger issue that uses up more resources.